Alright guys, so we'll quickly look at the next stuff which we'll be talking about, and this is the aspect of nerve compression. Nerve compression. So nerve compression is just simply something is pressing against something, okay, which in this case is a nerve we're talking about. So when there's a nerve compression, what will happen? Okay, so if you know the functions of a nerve, you should know what will happen when there's a compression of it, because those functions will be going away. So nerves that communicate to muscles to contract will not be able to communicate. Nerves that take sensations, pain, feeling, touch will not be able to do that, right? So it's also called nerve entrapment or pinched nerve, and usually occurs when a nerve is pressed by surrounding structures or tissues, such as the bones, the cartilages, the muscles, and the tendons. So common causes could be herniations or bulging disc, could be bone spurs, all those bony outgrowths, could be repetitive strain injuries, could be swellings or inflammations after trauma. It could just be that the person, the anatomical surroundings became tight. Several things could make it tight infections, injuries, the rest of it. So typical sites of compressions, we have the one at the cervical spine, we have the one at the lower back, we have the carpal tunnel syndrome at the wrist, we have the elbow, that's basically cubital tunnel syndrome. I'm just listening and passing because all of them will still come back and discuss them. Alright, then we also have the tarsal tunnel syndrome, okay, which is compression of the posterior tibial nerve. So symptoms is you're having a sharp or burning pain along the nerve path, tingling or pins and needles sensation, numbness in the affected area, and it could result into muscle weakness and also reduced reflexes. So that's what we got. So diagnosis is clinical examination. You can use imaging, all those MRI, CT scans to identify the disc herniation. Then also the electrodiagnostic test, where you're basically trying to look at how electrical impulses are still being transmitted through that nerve. Management is the person might actually decide to rest, reduce those strenuous activities around that place. You can also use drugs like the non-steroidal anti-inflammatory drugs to reduce inflammation, then physical therapies just to enhance movement and the rest of it. Also corticosteroid injections just to reduce inflammation.